Good morning. Well, it's morning right now. I don't know when you watch it, what time it's going to be, but I'm Dr. Peter Nakla, okay? And we're going to be going through pathophysiology. Very neat class. We learn, you know, what's normal with the body, what's wrong with the body, like these different diseases. And we go through different systems of the body looking at that. Signs, symptoms, treatment. I might have some stuff in there that we mention. But yeah, neat class. All right. It's probably one of my favorite classes to teach, to be honest. um, so we got to start at cells, right? We got to start at cell review. Prokaryotic versus eukaryotic cells. So prokaryotic, think like bacteria, very tiny. The only organelle is ribosomes, and they just care about themselves. Okay, their whole prime like jam is replicate, feed and replicate. Okay, and they're tiny. Okay, eukaryotic cells, that's what we have. We have organelles in there, membrane bound organelles. They take care of neighboring cells. They communicate with them. They care about their community, if you will. And to put it in perspective, the size difference, prokaryotic cells, we estimate, like bacteria, for example, there is more bacteria on you and in you than your own cells. That's how tiny they are. And needed. Okay, we need them for a bunch of different reasons. Okay. All right, so organelles, think baby organs. So you have the nucleus in your eukaryotic cells. That's where the DNA is. We protect it. It has a double membrane around it. The smooth ER, you think like detoxification. So in there's the enzyme like P450 or CYP450, CYP cytochrome. Cytochrome, I forget what it all stands for. Okay. Anywho, they've learned there's like subsets of these. People have different levels of it. So like when you give certain medications, how they break down the medication is a little different. So they're started now where they can test patients for it and see how much drug to give them potentially. This has an effect on alcohol breakdown. So like if someone drinks a lot, they'll have more, and that's why they can tolerate more alcohol. Eye cell disease, so this is a genetic disorder. They do not put the hydrolases, these enzymes, into the lysosome appropriately. That is a problem. It affects the cells. Lysosomes are for destroying structures. So it's a vesicle with lysozyme in it, this enzyme that's acidic, very aggressive. And so like say a white blood cell eats a bacteria and it takes it into a phagosome. You mate the lysosome with it and it destroys it. And that could be what stimulates our immune system, for example, once we do that. So if they have an issue with this, lots of other problems like illnesses, bacterial illnesses would be increased as well. All right, cell membrane. So our cell membranes have cholesterol in them. And that gives us fluidity and rigidity according to temperature. And that's important. Otherwise, our cells would just fracture. That's a problem, okay? So the example here, when the liver isn't functioning properly, cholesterol isn't made appropriately, and so the red blood cells become affected and carrying capacity is decreased. If carrying capacity is decreased, you're going to make more red blood cells. So now you have viscosity. So now you have increased risk of stroke or MI, clots, okay? So the compounding factor here from cholesterol. Side fact, okay? If I ever go and I talk about something extra, don't panic. It's not going to be testable material. It's just for your knowledge, connecting dots, that kind of thing. Okay? Makes it more interesting too. Fungi, they have ergosterol. It's almost the same as cholesterol, the structure. And so the problem with that is to create a medication to directly attack ergosterol is very, very hard. And so it affects our cholesterol. So that's why if someone has a toenail fungal infection, we don't give them systemic antifungals. We give them topical agents. They got to brush it on. And the crazy thing, I think the treatment's 72 weeks. takes that long to like get this fungi to die in your toenails. Do we give systemic antifungals? Yeah, sometimes we don't have a choice. They have it inside of them. Typically, you talk about these are immunocompromised patients, AIDS patients, cancer patients, bone marrow transplant, that kind of thing. It's not common. It's basically unheard of for a immunocompetent patient to develop a systemic fungal infection. We're that good at dealing with it, but there are those rare cases. Right? Cell membrane proteins, you guys, I'm sure, have looked at these. Many different functions, cell recognition. This is how we identify ourselves. So they could be like a structure like antigen, for example, and that's how we know self. And we need to know self so we don't attack it. But if we do, that's an autoimmune disease. There is a miscommunication there, for example. Okay? And then transmembrane proteins work as passageways. So if something is too big, for example, we need to pass through it. So you're like, oh, a little protein, why is that important? Who cares? Here's a prime example. One nucleotide is wrong in the DNA. Because that nucleotide is wrong, you don't make messenger RNA appropriately. Because you don't make messenger RNA appropriately, you miswrite the protein structure. One amino acid is wrong, the protein when it goes to fold is incorrect. Where it happens in there, in that coding, can alter the severity of a disease. Okay? That's how you can get sometimes like a spectrum of a disease. So here we talk about cystic fibrosis. The CFTR transmembrane protein, its job is to pump chloride into the lumen of your lungs or pancreas. And we mentioned these two organs because that's really what's affected in them. So when you pump chloride into the lumen, water follows. This creates a decrease in viscosity of the mucus. When there's the error, the mucus is very thick. It plugs the airways. It obstructs the airways. And so they get increased chance of infection because the mucus is like a slip and slide down into the lungs for the bacteria. The bacteria can hide in the mucus essentially from the white blood cells. So lots of problems there. So they tend to get a lot of pneumonias. And really the only way to solve this is a double lung transplant. I forget what the name of the movie is that came out a few years back where it was a bunch of kids that had a CF. And they showed they'd wear a vest and it vibrates and it helps break up those mucus plugs. Back before that, you would have to have like a family member or someone beat your back daily to help break up those mucus plugs. Same thing with the pancreas. That's where a lot of the enzymes come from that break down your food. Well, if it's obstructed, even though you're eating, if you can't break down the food to the monomers, amino acids, monoglycerides, all of that, monosaccharides, you can't absorb it. So even though you're putting food in your mouth, it's going through your GI tract, if it's not broken down to that monomer, it's like you're not eating. So they will have malnutrition. They have enzyme replacements for that. And I was talking to someone that has CF, and they were telling me it's like $10,000 a month for that replacement. Right? Maybe the price has changed now. This was a few years back, but pretty wild. All right, extracellular matrix. So this is really anchoring, okay? Adhesion, so growth, differentiation, and then wound healing. Plays, all these different roles. The problem is, like, cells need to be anchored so they can replicate, for example. So we need an anchoring point. The only cells that are going to disobey this are cancer cells. They have the ability to replicate whenever they want. And that's why it's so devastating. It causes like obstructions in like vessels, for example, because there's no ECM. They don't care. They just replicate. Okay. And the matrix is everything in there. So all the different proteins, the fluid, the collagen, all of that, that's the matrix. And then there's also Neo in there. Yes, that was a horrible joke. Neo from the Matrix. If you don't know what I'm talking about, you need to watch the Matrix movies. You'll understand after that. They're good movies. They're entertaining. All right. And I know I'm getting older than everyone now because not a lot of people, I'm sure, know who Neo is. Anywho. Gating, so these are channels that can regulate transfer cell to cell, okay? There's like voltage gating, okay, ligand, all that stuff, different types of gating. Gap junctions, so these are to tighten up the cell so things can't just pass through willy-nilly. We need to be able to control that. For example, I don't want my skin allowing fluid to leave my body readily, okay, or things to be absorbed through my skin. So we need these type of junctions as a protection. All right, endocrine, paracrine, and autocrine signaling. So this is hormone signaling. So for example, endocrine, we release into the bloodstream. So that's the key point there. We travel somewhere else in the body, and we signal that cell to do something. So a great example of this would be like ADH, antidiuretic hormone. Hypothalamus makes it. It goes stored in the pituitary. And then when you don't have enough water in your body, and we don't want to lose more, we release it into the bloodstream. It travels to your kidney. And then at the kidney, that commands it to insert aquaporins and reabsorb water back into our body. We don't want to pee it out. Okay. Paracrine, this is cell-to-cell signaling, like neighboring cells. So a great example would be beta cells in the pancreas, alpha cells in the pancreas. Beta releases insulin, alpha release glucagon. So what happens is, let's say you eat a big meal, your blood glucose level is high. I don't want glucagon being released because that would just drive my blood glucose level even higher. So I release insulin. As the insulin drifts out over those alpha cells, it turns them off. It's communicating with them, we don't need you right now. Autocrine, this is self-signaling, or the same type of cell, okay? Doesn't necessarily have to be right on himself. So an example here, I think, is like cholesterol production. So when we produce cholesterol, once levels are high enough, we would hit ourselves and turn off the cell, okay? We don't need to produce tons and tons of cholesterol because we get it from our diet as well. I get too much. High cholesterol. Yeah, I know. It's genetic, okay? It's genetic. No, it really is. It really is. But I still like my red meat too, so it is what it is. Anywho. So, endocrine, like we were talking about, bloodstream. That's the key point there to know. One site to a completely different site of the body. Paracrine. So this is neighboring cell. So another example here is like wound healing. Plays a role in here. And then autocrine. So this is cell, same cell. Okay. All right. So metabolism. You guys know this. You know this equation. All right. C6H12O6, right? Glucose, monosaccharides. All monosaccharides are this same formula. Oxygen, carbon dioxide, water, ATP. We use glucose because it's a fixed ratio. So we know the math. That's why it's used. But in reality, you could replace this with amino acid. You could replace this with fat. The ATP coming out on the back end is the only thing that's different. Okay? So glucose we eat, oxygen we breathe in. At the cellular level, we convert it to carbon dioxide and water and ATP and heat. Okay? Depending on the textbook you look at, one glucose molecule is worth 32 to 38 ATP. It's actually not a very efficient system because that's about like 67% efficiency. The rest is converted to heat. So not the most efficient, okay? 2/3 efficiency. However, in the absence of oxygen, we go into fermentation. One glucose molecule gives you 2 ATP. That's extremely inefficient. Some cells in our body like it. They're like your fast twitch muscles, stuff like that, like your eyelids, your fingers, stuff like that. If you move them too much, they fatigue pretty quickly. That's because they're doing like a lot of fermentation. They typically call it like white muscle. It's not as red because it has less myoglobin, because you need myoglobin to bind the oxygen from your hemoglobin, and so there is less there. The fermentation process, like I said, it's inefficient. Some cells prefer it. Cancer cells prefer it. They really abuse it. It's quick energy. So the problem with that is, if you ever known anyone with cancer, towards the end of their battle with cancer, unfortunately, they start to lose a lot of weight. That's cachexia or consumption, and it just, the nutrition in their body is being used up by the cancer cells because of the rapid mitosis and fermentation. It sucks the life out of people. I mean, that's the best way to put it. It starts breaking down their protein structures, like their muscle, whatever, their stored fat, and there's nothing you can do about it. You can throw as much nutrition as you want at them. The cancer will just keep chugging along. Right? Cell transport. Remember with this that we need transmembrane proteins if things are large or if they're polar. Okay? That's where we're going to need this. No net flow means we're balanced in that situation. And so sometimes we need pumps that use ATP to push and create gradients, for example. Okay. There we go. All right. So, protein transporters. So you have uniport, that's just one thing, one way. Symport, two things together. And antiport, opposites. So this one you usually learn, the sodium potassium ATPase pump. Okay. Symport, a great example of symport is basically in your GI tract for monosaccharides and amino acids are symports. They need sodium, so you would say like glucose, sodium, and then you can pull both in. So that's a great example of why I like Gatorade. Gatorade has glucose in it and sodium, increases your absorption. Okay. Uniport, pretty much anything. I mean, like aquaporin, pretty much anything. Okay, if it's by itself. All right, so the water, because it's polar, you need aquaporins. Large protein, it's big. I'm going to need a transmembrane protein. Glucose, I need a transmembrane protein. Oxygen, it's non-polar. Flows right in. Bacteria, they need to be pulled in. They're too large to just pass through. We'll talk about that in a second. Okay? Carbon dioxide, non-polar. I need it to flow in and out freely. Okay? We don't want to waste energy moving oxygen and carbon dioxide. So we rely on gradients. So like you think like in the lungs, I need a lot of oxygen out here and less in me, in my vessels, so that in my lungs, it just flows in. And then we grab it with the hemoglobin. Same with carbon dioxide. If there's too much carbon dioxide out here, I can't leach out the carbon dioxide from my bloodstream through my lungs. All right. So receptor-mediated endocytosis. This is bacteria. So either we want to eat the bacteria, so that's phagocytosis. That's talking about, like a white blood cell. Receptor-mediated endocytosis, something hits a receptor on your cell. It's like the doorbell on your cell, and it opens the door and pulls it in. Okay, it's that the uninvited guest that we do not want, right? We need this. We use this. So like LDL, for example. LDL, we produce it in our diet. And what happens is when the LDL strikes the receptor, it gets pulled into the cell. Well, the problem is if you don't have doorbells, you're going to get more knocks. And so the LDL concentration increases in your bloodstream. That's familial hyperlipidemia. So I was joking, the high cholesterol, that's what I have. So like at 18, it started climbing. I mean, my LDL at some point was 230 something, some astronomical number. It should be below 70. So I've tried different medications, statins, Lipitor, all that good stuff. I went through 4 different ones. And just every single medication had problem. And they weren't bringing my levels down enough. So now I'm on a monoclonal antibody called Repatha. So I have basically an injection I take every 2 weeks, and I got the reminder just a few minutes ago to take it today. But it lowers my cholesterol. It basically turns off the production of LDL in my body. The best I could get down on a statin was 140, I believe. So I was still double where I need to be. After like a month of injections, I think I was at 67, something like that, in the 60s. It's pretty impressive. Okay. New medications, game changer. All right, DNA structure. So here, this is chromatin. This is the expanded DNA. We can read this. So when a cell is just transcribing, it's making proteins, it's not replicating, that's where your DNA is sitting. We condense parts of our DNA using histones. So whenever the DNA is wound up, you can't write from it. So every cell in your body has all your DNA. I don't need my skin cells knowing how to make acid like my stomach cells. So those parts are inactivated. Okay. When we go to divide, this is a duplicated chromosome. So we'll condense it all down, we'll duplicate it, and then we'll pull it apart, separate it. Okay. So mitosis, this should be G0. That's an error. Okay. Cells that are dormant stay in G0, so they're outside of the cell cycle. If they enter G1, they're going through mitosis. We have what's called the retinoblastoma or RB protein. This helps inactivate the replication process. So if this is defective, it can start replicating on cells. You get cancer if they're replicating uncontrolled. Okay, so when we phosphorylate RB protein, it inactivates it, and the cell can replicate. So that's what this is showing here. We separated it, phosphorylated it, and now we can enter transcription, translation, cell growth. Okay. This can be defective in people. This is one of those checkpoints in your cell cycle. So if it's defective, they develop a tumor in the eye, hence the name retinoblastoma. And it's typically caught in the past when a parent takes a picture of their child and they'll see in the eye it's glowing like red eye, just one eye, and it can get worse and worse. It can cause blindness. It is treatable. I had a student, that exact situation had happened. My old program, her husband had taken a picture of their child and noticed it, and like they took him to the eye doctor, and that's when they were like, yeah, you need to go, surgery or whatever. But they treated it early enough, and he kept his vision. So pretty wild. All right. So growth factors. Growth factors stimulate cells to reproduce, all of that. So HER2, for example, is one that's seen in breast cancers. And you probably heard about this on TV. They talk about if it's triple negative breast cancer, that's a problem. So some of the new targeted medications block these receptors and basically turn off the cancer. And the cells can die out. So the problem is when you get to these triple negatives, they're missing all these receptors. There's no switch for us to block. That's where we're stuck at on this. But it's interesting that they can treat now by looking at the receptor. So the cancer advancements, like medication-wise, treatment-wise, are impressive. Transcription, translation. So transcription is writing the messenger RNA, and that goes to the ribosome, and we translate it to protein structure. And it's interesting because this right here, these are these new vaccines that have been rolling out. So these are your mRNA vaccines. We give you this, you build the protein structure. What is the protein structure? It's like the antigen of the organism we want you to get vaccinated against. So there's no chance of you catching the organism or the illness from the vaccine. Like we have live vaccines like MMR, measles, mumps, rubella. That live vaccine, when we give it to you, there is a risk that you will develop measles or mumps or rubella. But we take that risk because of the protection level. And I don't know if you guys saw, depending on when you watch this, but right now, there's been measles outbreaks here in Georgia. And it's pretty wild. In every single case, it is an unvaccinated person that traveled abroad and came back with it. It is ultra rare to hear about someone was vaccinated and still caught it. Can they? Theoretically, yes, if something was wrong with the vaccine or their immune system, something like that. Okay? They get a bone marrow transplant. Well, if the previous person wasn't vaccinated, you're in trouble. Okay? And even then, you got to vaccinate them all over again. Right? That's part of their protocol. So yeah, it's a neat technology. It's been around actually from the early 2000s. There was another, I think it was for SARS or something, where they used that vaccine style. So it was crazy. Like people were so worried about, well, they just rushed through making the vaccine. They didn't test it, whatever. All they did was change the ATGCs in here. Okay? They just spelled the word differently, essentially. That's all it is. And the ribosome just reads it and makes this little protein structure. That's the difference. All right, genes. So they're Levi's, they're Wrangler. I know. It gets worse. So genes, this is the genetic information on your DNA, on your chromosomes. These can be faulty. We can be missing a piece. Extra pieces stuck on. An extra gene an extra chromosome in its entirety. And this is where we start to get a lot of these disorders. And a lot of it comes from age related. It's with the female, the egg is as old as she is. Like they were generated in utero. And so you think about it, if you're 35 years old, it is now considered a high risk pregnancy as a female. Why? The egg is 35 years old. So when it goes to divide, errors can happen. The structures in there can just fault. For males, it doesn't happen until like their 60s because they make new sperm every 2 months. It's not very old. Okay? So, big difference there. And we'll talk about a lot of these defects involving genes and whatnot as we go on.